motion to be welcome. Please raise hand if you could have any question. Thank you.
দেখছি এখন আরেকটু নিয়ে যান বাকি একটি কলকাতার আরেকটি কলকাতা করে দিব So I am sure that Dhaka Medical College and Hospital from institution from 1946, they never advertised for any treatment or anything. And as last day, about 3,500 outpatients have been seen and 450 emergency patients have been seen by Dhaka Medical College Hospital. And as our Supervisor has mentioned that Dhaka Medical College is the competitor, I told how Dhaka Medical College Hospital became the competitor. I think the other hospitals made it a competitor. In Dhaka Medical College, every treatment surgery is free of cost, and now we are doing that laparoscopic surgery, which is also free of cost. And my professor working in Dhaka Medical College left for Star Hospital for a salary of about $5,000, and I'm still working there for a salary of $500 because of social commitment. Because as a graduate of Dhaka Medical College, I have studied free of cost. My niece graduated from Harvard University free of cost. She has to pay $40,000 in Boston Medical for medical. So they don't have that social commitment that much. They are paid, but we are free of cost. So my question, how do you think Dhaka Medical is the competitor of this private sector?
Once for the microgen initiative. I would actually just two comments for someone who is not here. I would like to comment for Dr. Roy that among the civil societies we have to remember the imams, the religious leaders. He mentioned churches only, that we are forgetting about that in our country we are 90% Muslims. So we have to remember that society where we have to go back again and again to advocate to them that health and nutrition is much needed in the society. And Philip Elite, he cannot forget that because as he has seen in Dr. Colin Dr. Colin's presentation, that it's the Elite who actually donated land for the community clinic, which is something that the society has done. And Dr. Subal, I'm sorry, I have not to let again just go back to you and our previous questioner. Yes, we know that the private sector provides 80% of the services. So I would like to say we have to strengthen. Our motto should be we need to strengthen the government, the public health sector, and the civil society somehow has to mention it again and again. Whatever way we have, because the poor, at the end of time, our vulnerable population goes to the public sector. They cannot afford the private sector. So it is our duty actually to find ways out from the civil society to promote the public sector. Thank you.
We have 30 million people without any health insurance. The richest country in the world has 30 million people without health insurance. And despite what President Obama did to establish his health care system, they still will have over 5 million people without health insurance. So my question to Dr. Sabur and to all the members of the panelists is, has the time come to join both the private and public sector together to provide one standard of care so that you care for the poor no different than you care for the rich? Has the time come for all of us to put together all of our resources and work together so that doctors don't have to work in the public sector in the morning and the private sector at night to make ends meet? Has the time come for doctors to earn less in the public sector trying to do the very best to provide the best quality care? That's my question to all of you. Thank you.
And it is how you treat patients in the hospital. The patient is coming, is not saying that you are not allowed to get better. You go to the private sector, if there is 50 beds, 51 patients will not be allowed because they have to pay for that. So the most important change and challenge is paying for the treatment and non-paying for the treatment. So in Bangladesh, it is very difficult to compare the public sector and private sector because private sector will be a profit-making organization. Public sector is not only non-profit, not like it is a subsidious organization. by the government. So it is very difficult to have complications with it. I understand the services that has provided by the different public sectors is again challenging. Because if you go to standard hospital like Apollo, if you the other hospitals, the services are very high, but pay is very high. And if you go some other hospitals, private clinics, the quality of the service is very poor, poorer than the medical college. But again, they are getting on. So the accreditation is there, rules is there, not for the other hospitals as much, but for those who are not providing the quality service, but getting the money from the government. That is even high cost. So we have to look into that issue very carefully. Thank you, Professor.
First, I will disagree, and I will disagree with evidence that nothing is free in Dhaka Medical College Hospital. Nothing is free in Dhaka Medical College Hospital. Everything is paid twice, four times. One is an official fee, another is undertaking fee, and that undertaking fee goes across the board. So, I, as a citizen of Bangladesh, is paying the taxes through which Dhaka Medical College is run, and then when I go to Dhaka Medical College, I have an official fee to be paid, and I have unofficial fees to be paid. How many times should I be paid? And all studies, I'm sorry Dr. all studies showing that the poor tends to be very away when it comes to the district hospital. Upurjana and below will get some service for the poor. District and above hospitals don't serve the poor. None of the studies has shown us that any district and above hospital serve the poor. Not even the slum dwellers. Okay? In Dhaka, we have poor people. But Dhaka Medical College Hospital don't serve them. Let me give you one example. One of the two pillars of economy in this country is the garment factory. Okay? Nobody denies that. This garment factory is a pillar of the economy of this country. Okay? The other is being paid for. They don't live in that. What this public sector is doing for the garment girls? If I am a garment girl, I need to work from 7 a.m. to 10 p.m. When I come back at 10 p.m. with headache and lot of back pain, none of the public sector is open for me. I am staying in the public sector. Okay? So let's be realistic about the public sector. How much it serves and whom it serves. It serves the elite. And this is why this is publicly financed. Because this elite makes the decision. Okay? And if the public sector doctors, many of my colleagues, see patients up to 12 midnight, 1 a.m. Can they start from 8 a.m. again in the public sector hospital? These are not machines. These are the human beings we are talking about. So, you milk your position. And this has been evidence many times. When the public sector doctors lose their position in the public sector, the private practice won't start. This is again and again. Okay? So for many of my public sector colleagues, public sector gives the milking opportunity for their private practice. And this is nothing uncommon. If you go to Dhaka Airport, go to station, go to the other places, first flights. All Thursday flights are filled up with the public sector senior doctors going to serve with the district hospital. And they serve, but it is not the public sector hospital. At the district, they serve the private. So let's be very clear about this distinction. Okay? And what I was trying to say, that if you are talking about quality of care, if you are talking about the standard should be quality. You can't have a standard for one hospital and not for the other hospital. And that is exactly what we are trying to do here. As director of hospital, uneducated, who gives permission to the private clinics and hospitals, he has a standard to follow. He never applies this standard to the same hospital as director of hospital whom he is supposed to supervise. Okay? So when it comes to the private hospital, one standard. When it comes to the same person, same position I am talking about. Okay? I know that I am going out of the time. Thank you very much for giving me the opportunity.
Actually, we just want to continue, but this debate needs a full day. because he has issued a number of non-important issues. But the time is very short, but we will organize a special program for the very future.
Thank you very much, Professor Shah, sir.